Good evening. This is All India Radio. I am Lalema Aneja Dang, and with me is Renuka with the evening news. The headlines. Vaccine registration for COVID-19 to all above 18 years begins this evening. Drive to start from 1st of May. Prime Minister Narendra Modi sanctions procurement of 1 lakh portable oxygen concentrators under the PM CARES Fund. Prime Minister holds telephonic conversations with the Russian President Vladimir Putin over COVID-19 situation, also reviews bilateral cooperation. Serum Institute of India reduces price of COVID shield from 400 rupees to 300 rupees to states. Government intensifies efforts to supply medical oxygen across the country. Railways delivers more than 510 metric tons of oxygen so far. Over 14 crore 78 lakh people inoculated with COVID-19 vaccines in the country so far. More than 2,61,000 people recover from COVID-19 in the last 24 hours. Election Commission rolls out strict COVID-19 protocols for counting of votes on the 2nd of May. Preparations being finalized for the last phase of West Bengal Assembly elections tomorrow. And in IPL cricket, Sunrisers Hyderabad wins the toss and opted to bat first against Chennai Super Kings. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the persons of age between 18 and 44 would begin from the 1st of May at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. The registration process for COVID vaccination to all above 18 years began at 4 p.m. today. They will be vaccinated in the 3rd phase of COVID vaccination drive starting from the 1st of next month. All those eligible can register on CoWIN portal, that is COWIN.gov.in, Arogya Setu app and Umang app. In this phase, the vaccination will continue as before in central government vaccination centres, free of cost to the eligible people, including healthcare workers, frontline workers and all above 45 years of age. During this phase, vaccine manufacturers will supply 50% of their monthly released doses to the central government, and they will be free to supply the remaining 50% doses to states as well as in the open market. No walk-in facility will be provided for vaccination in this phase. All above 18 years will need to mandatorily register online on the CoWIN platform, Arogya Setu app and Umang app. The registration will be done with the help of mobile number. People will have to fill up their details and upload 1 photo ID proof. After that, they will have to schedule their appointment at a centre of their choice. Appointment for age 18 to 44 is based on slots made available by the private vaccination centres as well as the state governments.
The Union Government has provided nearly 16 crore doses of COVID vaccines to states and union territories free of cost so far. Of this, the total consumption of doses including wastages is over 14 crore 89 lakh. The Ministry of Health and Family Welfare has informed today that more than 1 crore doses of vaccines are still available with the states and union territories. The ministry has assured that more than 57 lakh vaccine doses will be provided to states and union territories within the next 3 days. On the alleged shortage of vaccines in Maharashtra, the ministry has clarified that over 1 crore 58,000 doses of vaccine have been received by Maharashtra so far. Of this, the total consumption including wastage was over 1 crore 53 lakh. The ministry said a total of 5,06,319 vaccine doses are still available with the state. It added that 5 lakh doses of vaccine will be delivered in the next 3 days. The Health Ministry has said vaccination is a crucial pillar in the fight against the coronavirus, and the 3rd phase of COVID-19 vaccination will be implemented from the 1st of May. The ministry has informed that over 12,92,000 doses of vaccine are available in Uttar Pradesh, followed by Bihar, wherein 9,41,000 doses are left.
Prime Minister Narendra Modi had a telephonic conversation with Russian President Vladimir Putin this evening. They discussed the evolving COVID-19 situation. President Putin expressed solidarity with the people and the government of India and conveyed that Russia would extend all possible support in this regard. Mr. Modi thanked President Putin for Russia's help and support in India's fight against the pandemic and noted that prompt Russian support to India is a symbol of our enduring partnership. The two leaders noted the ongoing cooperation between the two countries to fight the global pandemic. Approval for emergency use of Sputnik 5 vaccine in India was appreciated by President Putin. The leaders noted that the Russian vaccine will be manufactured in India for use in India, Russia and third countries. In a tweet, Mr. Modi said, "Our cooperation on Sputnik vaccine will assist humanity in battling the pandemic." Both leaders attached importance to further deepening bilateral cooperation in various sectors in the spirit of a special and privileged partnership. They reviewed the diverse bilateral cooperation, especially in the area of space exploration and renewable energy sector, including hydrogen economy. Mr. Modi conveyed appreciation for the support received from Russia for India's Gaganyaan program and the completion of the Russian phase of training of the 4 Gaganyaan astronauts.
Prime Minister Narendra Modi has sanctioned the procurement of 1 lakh portable oxygen concentrators from the PM CARES Fund. The decision was taken at a high-level meeting chaired by Mr. Modi to discuss the measures needed to improve liquid medical oxygen supply for COVID management. The Prime Minister instructed that these oxygen concentrators should be procured at the earliest and provided in states with high case burden. In addition to the earlier sanctioned 713 pressure swing absorption PSA oxygen plants under the PM CARES Fund, 500 new PSA oxygen plants have been sanctioned under the PM CARES Fund. The PSA plants will augment the supply of liquid medical oxygen at hospitals and district headquarters and Tier 2 cities. These 500 PSA plants will be established with transfer of the indigenous technology developed by the DRDO and the CSIR to the domestic manufacturers.
Serum Institute of India has slashed the price of Covishield vaccine by 100 rupees for state government. In a tweet, Serum's CEO Adar Poonawalla said that as a philanthropic gesture, Serum Institute will provide Covishield to states in 300 rupees with immediate effect. This will save thousands of crores of state funds going forward. He said this will enable more vaccinations and save countless lives. Serum had priced Covishield at 400 rupees for state government hospitals and 600 rupees for private hospitals.
The government has intensified efforts to boost the supply of medical oxygen in the country. The union government has informed that 50 metric tons of medical oxygen will be provided by the fertilizer plants on a daily basis in the coming days. This move will augment the medical-grade oxygen supply to hospitals in the country. The Ministry of Chemicals and Fertilizers has informed that the Indian Farmers Fertilizer Cooperative Limited is putting up an oxygen plant having capacity of 200 cubic meters per hour in its Kalol unit in Gujarat. The plant's total capacity would be 33,000 cubic meters per day. In addition, Gujarat Narmada Valley Fertilizers and Chemicals has also started supplying liquid oxygen. The ministry has also informed that the other fertilizer companies will set up medical oxygen plants in hospitals.
Civil Aviation Minister Hardeep Singh Puri has said that Air India is going to airlift 10,636 oxygen concentrators manufactured by Philips from various countries. In a tweet, the minister said that such 636 concentrators have already flown in from US to India. He said the consignments are flying in every day and the whole task will be completed within this week. The Indian Railways is continuing its journey of delivering liquid medical oxygen to various parts of the country. So far, more than 510 metric tons liquid medical oxygen has been delivered to Maharashtra, Uttar Pradesh, Madhya Pradesh and Delhi. Haryana government has also requested the railways for Oxygen Express. Currently, tankers are being loaded in Faridabad, which will be sent for filling to Rourkela. As of now, it is planned that 2 Oxygen Express with a capacity of 5 tankers each will be run specifically for Haryana. Madhya Pradesh has received its first oxygen express carrying more than 64 metric tons of liquid medical oxygen today early morning. Fourth oxygen express destined for Lucknow will be reaching Lucknow today carrying 3 tankers of liquid medical oxygen. So far, the Indian Railways has delivered 202 metric tons to Uttar Pradesh, 174 metric tons to Maharashtra, 70 metric tons to Delhi, and Madhya Pradesh 64 metric tons.
Strengthening the capabilities of the nation in the united fight against COVID, the Ministry of Railways has deployed nearly 4,000 isolation coaches with almost 64,000 beds. To work concurrently with the states and in a bid to reach out as swiftly as possible, the railway has drawn a decentralized plan of action empowering zones and divisions to work out their memorandum of agreement for cohesive action. These isolation coaches can be easily moved and positioned at places of demand on the Indian Railways network. As per states' demand, at present 191 coaches have been handed over to various states for COVID care with a bed capacity of 2,990 beds. Isolation coaches are presently utilized in Delhi, Maharashtra and Madhya Pradesh. The Railways has also positioned 50 coaches at major cities of Uttar Pradesh like Faizabad, Bhadoi, Varanasi, Bareilly and Nazibabad. The Defence Research and Development Organization (DRDO) will set up 500 medical oxygen plants within 3 months under the PM CARES Fund. Defence Minister Rajnath Singh informed that the medical oxygen plant technology developed by the DRDO for on-board oxygen generation for light combat aircraft Tejas will now help in fighting the current crisis of oxygen for the COVID-19 patients. The minister appreciated the DRDO for using its technology to generate much-needed oxygen for COVID-19 patients, which he said will help in overcoming the present crisis.
The Indian Army has stepped up the hospital facilities at Delhi cantonment to fight COVID surge. A COVID facility has been created at Base Hospital, Delhi cantonment, where the entire hospital has been converted into a COVID hospital. At the start of the current COVID wave, the base hospital catered for 340 COVID beds, of which just 250 beds were oxygenated. This is being expanded to 650 COVID beds, of which 450 beds will be oxygenated by the 30th of this month. The ICU is also being enhanced from 12 beds to 35 ICU beds by tomorrow. The next phase of expansion will see the present capacity being augmented to 900 oxygenated beds by the second week of June. For efficient patient management, a new COVID OPD under a specialist medical team is functioning round the clock. This team clinically examines approximately 500 patients on a daily basis.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Vaccine registration for COVID-19 to all above 18 years begin this evening. Drive to start from 1st of May. Prime Minister Narendra Modi sanctions procurement of 1 lakh portable oxygen concentrators under the PM CARES Fund. Prime Minister holds telephonic conversations with Russian President Vladimir Putin over COVID-19 situation, also reviews bilateral cooperation. Serum Institute of India reduces price of Covishield from 400 rupees to 300 rupees to states. Government intensifies efforts to supply medical oxygen across the country. Railways deliver more than 510 metric tons of oxygen so far. Over 14 crore 78 lakh people inoculated with COVID-19 vaccines in the country so far. More than 2,61,000 people recover from COVID-19 in last 24 hours. Election Commission rolls out strict COVID-19 protocols for counting of votes on 2nd of May. Preparations being finalized for the last phase of West Bengal Assembly elections tomorrow. And in IPL cricket, Sunrisers Hyderabad wins the toss and opted to bat first against Chennai Super Kings. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
The country registered the grim record of the highest number of fresh COVID cases and deaths due to the virus today. The record spike in coronavirus cases has increased the active caseload in several states and union territories. The Health Ministry has informed today that over 360,000 fresh cases have been reported in the country within 24 hours. This is the highest number of cases registered in a day since the outbreak of the pandemic in India. The ministry has informed that at present there are over 29,78,000 active cases in the country, which comprises 16.55% of the total positive cases. The recovery rate now stands at 82.33%. The ministry has said that more than 2,61,000 people have recovered from the infection in the last 24 hours. So far, over 1,48 lakh patients have already recovered from this infectious disease. The Health Ministry has said that over 3,293 deaths have been reported in the country within 24 hours, taking the toll to over 2 lakh across the country. This is the highest number of deaths registered in a day since the outbreak of the COVID-19 pandemic.
In the Union Territory of Jammu and Kashmir, complete lockdown shall be imposed in 11 districts beginning from 7 p.m. tomorrow till 7 a.m. of 3rd of May, in view of the alarming surge of the positive cases being reported nowadays. The districts are Srinagar, Anantnag, Baramulla, Budgam, Kulgam, Pulwama, Gandarbal, Jammu, Kathua, Riasi and Udhampur. However, there shall be exemptions on the essential services. Meanwhile, another single-day spike of 3,023 COVID-19 positive cases have been reported in Jammu and Kashmir today. Out of these cases, 989 were reported from Jammu Division, while 2,034 from Kashmir Division. 30 COVID deaths were also reported, 12 from Jammu Division and 18 from Kashmir. The Karnal District Administration in Haryana has started a unique Oxygen on Wheels initiative to ensure incessant supply of medical oxygen to both government and private hospitals. Under this initiative, a carrier vehicle called as Mobile Oxygen Bank loaded with 100 oxygen cylinders reaches out to any district hospital which requisite its urgent supply. This round-the-clock service has been able to cater to the demands of various hospitals in the area. Speaking to AIR News, Deputy Commissioner of Karnal District Nishant Yadav informed that the hospitals reach out to the oxygen bank service when they are left with nearly 2 hours of oxygen and are provided with requisite number of cylinders to ensure complete care of patients.
I would like to request all the citizens that they need not to be afraid. They need not to be in panic. The administration, the government is taking good care of them. We have started this initiative called Oxygen on Wheels, by which we are providing oxygen to each and every hospital whenever they are in distress, whenever they need it immediately, whenever their quota get exhausted. So the initiative is just to make sure that not even a single patient dies due to non-availability of oxygen.
In Uttar Pradesh, BJP MLA from Bareilly, Kesar Singh Gangwar, today succumbed to the infection from coronavirus. He was admitted in a hospital at Gautam Budh Nagar from the last few days after being infected from COVID-19. With this, 3 BJP MLAs have lost their lives in the second wave of COVID-19 in the state. Earlier, BJP MLA from Lucknow, Suresh Chandra Srivastav, and party MLA from Oraiya, Ramesh Divakar, had died recently because of the infection from COVID-19. The Bihar government has taken decision to impose curfew from 6 p.m. to 6 a.m. tomorrow onwards. Shops and business establishments will be closed by 4 p.m. Essential services have been exempted from this order. These decisions were taken by the Crisis Management Group. Principal Health Secretary Pratyay Amrit said 50 persons will be allowed for marriage ceremony, while only 20 persons will be permitted for funeral procession. Marriage ceremonies to be wound up by 10 p.m. Government and private offices will be closed after 4 afternoon. 25% attendance will be allowed in offices. The state government will bear all the expenses of funeral of those who died due to COVID and related diseases.
In Jharkhand, amidst the growing number of COVID-19 cases detected every day, the state government has decided to extend the period of ongoing Health Safety Week in Jharkhand till 6th of May for another 1 week. The decision has been taken during a meeting of State Disaster Management Authority chaired by Chief Minister Hemant Soren today. More details from our correspondent.
The ongoing Health Safety Week being observed in Jharkhand has been extended for another 1 week beginning from tomorrow 6 a.m. in the morning till 6 in the morning of May 6th. to break the chain of spread of COVID-19 in the state. In the new extended Health Safety Week, the shops in the state will remain open only till 2 in the afternoon, while movement of people will be allowed only till 3 p.m. Any restrictions on essential and medical services have been barred under the new order. Meanwhile, Chief Minister Hemant Soren today inaugurated a 40 oxygen-supported bed hospital from his healthcare center under Ranchi Municipal Corporation for better treatment of COVID-19 patients in Ranchi district. Shilpi, AIR News, Ranchi.
The Maharashtra government will also provide free vaccination to all the citizens between the age group of 18 to 44. Health Minister Rajesh Tope said the government is targeting complete vaccination of these citizens within 6 months. Meanwhile, he also clarified that restrictions imposed in state will be extended beyond 30th of April in the state. The decision about number of days of extension will be announced in a few days.
Maharashtra Cabinet has decided to provide a free vaccination at government hospitals to all the citizens between the age of 18 to 44. Maharashtra has 5 crore 71 lakh citizens in this age group and expenditure of 6,500 crore is expected on this. Health Minister Rajesh Tope said that the existing centers will continue vaccination of citizens above the age of 45. Separate vaccination centers will be established for the citizens between the age group of 18 to 44. He also clarified that due to limited availability of vaccines, vaccination of new age group may not start from 1st May. A detailed vaccination policy for this age group will be declared within a few days. Jeevan Bhavsar, AIR News, Mumbai.
Goa to go for 4-day lockdown from tomorrow evening at 7 till Monday at 6 a.m. This was announced by Chief Minister Dr. Pramod Sawant at a press conference held in Panji. Public transport service will be closed. Essential commodities, shops and grocery shops to remain open, Chief Minister Dr. Sawant informed further. Industrial services within campuses will be permitted. Casinos and bars, restaurants will be closed. Vaccination will continue. The decision was taken to curb the spread of coronavirus in the state.
The Puducherry administration has extended the lockdown till 3rd of May following the increasing COVID cases. Today, the Union Territory registered 1,258 new COVID cases.
While talking to media persons, District Collector Mrs. Purva Karg informed that the provision stores, vegetables and fruit shops, groceries, dairy and milk booth, meat and fish, animal fodder will function. Hospitals, medical shops and all medical emergency cases are allowed. Agriculture and its allied activities will be permitted. Rental vehicles and taxis are permitted to ply with 4 persons including driver, and autos are permitted to ply with 3 persons including driver. On the other side, big formality shops, shopping complexes and malls will be closed. In the restaurants and eateries, only home delivery and takeaway are permitted. All religious places will be closed for public worship. Marriages can happen with 50 people, while in funerals, only 25 participants permitted. Chandramohan, AIR News, Puducherry.
Kerala reports highest single-day surge in COVID cases today as it confirms 35,013 new cases. The test positivity rate is at alarming 25.34%. 15,505 recoveries are also reported today. 41 deaths are confirmed due to COVID. Presently, 2,66,646 active COVID cases in Kerala. Talking to AIR News, Dr. Anjan Trikha of AIIMS, New Delhi, has urged people to self-isolate themselves in case they get infected with coronavirus.
If you are infected and you are asymptomatic, so you have to see for yourself that you don't spread it to other people. So you go into isolation, do not sit with your friends or co-workers to eat food or to have tea or anything else, or sit together and watch a TV on the same sofa. Remain isolated in your room and stop going to your office or your place of work. If you are infected and you have any kind of symptom, you have named symptoms like fever and cough, so you should be on regular medications as per the doctor to take care of your fever round the clock, and you could be having some kind of a cough syrup so that your cough is suppressed.
The Election Commission has rolled out strict COVID protocols for the counting day of elections held in 4 states and 1 union territory of Puducherry. As per the safety measures, no candidates or poll agents will be allowed inside the counting hall without undergoing RT-PCR or rapid antigen test. However, those who have been administered both the doses of COVID vaccination have been allowed. The Commission has prohibited public gathering outside the counting venue during the process of counting. Counting for the state elections held in Assam, Tamil Nadu, West Bengal, Kerala and the Union Territory of Puducherry, along with for the by-elections of various states, will be done on the 2nd of May. All the necessary preparations being finalized for the last and eighth phase of election for 35 assembly constituencies in West Bengal for tomorrow. Over 84 lakh voters are eligible to decide the fate of 283 candidates contesting in the 6 constituencies of Malda, 11 each in Murshidabad and Birbhum, and 7 constituencies in Kolkata North. Voting will be held between 7 a.m. and 6:30 p.m. in 11,860 polling booths. Security measures have been tightened in view of the violence in the previous phases, particularly the death of 5 people in Cooch Behar in the 4th round of polling on April the 10th.
The poll panel has taken measures to ensure strict adherence to COVID-19 protocols during the voting process tomorrow. Only 1,000 voters are allotted for each booth to avoid crowding. The measures were taken to vaccinate polling personnel. The EC had banned road shows and vehicle rallies in the state. It also disallowed any public meeting with more than 500 people. It had also curtailed daily campaign hours and extended the silence period from 48 hours to 72 hours in the last 3 phases. Masks, gloves and sanitizers in each booth were made mandatory. The Election Commission of India had banned yesterday all victory processions on or after the day of counting of votes on May 2nd due to the spike in COVID-19 cases. Sudhindra, AIR News, Kolkata.
Amidst an increasingly bitter diplomatic and trade spat with China, Australia has announced to spend $580 million to upgrade its 4 northern military bases. Prime Minister Scott Morrison said that Australia must expand its military assets in the Northern Territory to be able to respond to unspecified tensions in the Asia-Pacific region. He added that Australia's objective is a free and open Indo-Pacific to ensure a peaceful region so that Australia is in a position to protect its interests. Russia's foreign ministry has ordered the expulsion of 7 diplomats from Slovakia, Lithuania, Latvia and Estonia in a retaliation for the expulsion of Russian envoys. The ministry gave the 3 Slovak and 2 Lithuanian diplomats as well as an envoy from Latvia and another from Estonia 1 week to leave Russia.
In IPL cricket, Sunrisers Hyderabad were 129 for 2 in 17.2 overs against Chennai Super Kings in New Delhi when reports last came in. Earlier, Sunrisers Hyderabad won the toss and chose to bat first. Yesterday, Royal Challengers Bangalore RCB registered a thrilling 1-run win over Delhi Capitals as Mohammad Siraj defended 14 runs in the final over in Ahmedabad. And now let's take a look at the weather forecast for tomorrow. In Srinagar, temperature will hover between 10 and 28 degrees Celsius. In Jammu, the minimum temperature will be 23 degrees Celsius, while the maximum should be around 38. Leh is expected to have mainly clear sky. Minimum and maximum temperature shall be 2 and 16 degrees Celsius. Gilgit will also have mainly clear sky. Temperatures will hover between 10 and 32 degrees Celsius. Muzaffarabad is likely to have mainly clear sky, becoming partly cloudy towards afternoon or evening. The minimum temperature will be 15 degrees Celsius and maximum around 35. Dehradun will witness partly cloudy sky with the possibility of thunder and lightning. The minimum temperature shall be 20 degrees Celsius and maximum 38. Chandigarh will have partly cloudy sky and temperature will hover between 22 and 40 degrees Celsius. The national capital Delhi will have partly cloudy sky. Temperatures will hover between 22 and 42 degrees Celsius. And now, before we end the bulletin, the headlines once again. Vaccine registration for COVID-19 to all above 18 years begins this evening. Drive to start from the 1st of May. Prime Minister Narendra Modi sanctions procurement of 1 lakh portable oxygen concentrators under the PM CARES Fund. Prime Minister holds telephonic conversations with Russian President Vladimir Putin over the COVID-19 situation, also reviews bilateral cooperation. Serum Institute of India reduces price of Covishield from 400 rupees to 300 rupees to states. Government intensifies efforts to supply medical oxygen across the country. Railways deliver more than 510 metric tons of oxygen so far. Over 14 crore 78 lakh people are inoculated with COVID-19 vaccines in the country so far. More than 2,61,000 people recover from COVID-19 in the last 24 hours. Election Commission rolls out strict COVID-19 protocols for counting of votes on the 2nd of May. preparations being finalized for the last phase of West Bengal Assembly elections tomorrow. And in IPL cricket, Sunrisers Hyderabad win the toss and opted to bat first against Chennai Super Kings. Well, that's all we have for you in the evening news. Good night.